Hello guys, in this video we want to talk about the complications of diabetes and how to prevent these complications. Stay with us. Treating diabetes may seem difficult at first, but when you consider the complications of diabetes, you will see that it is worth it. Uncontrolled diabetes means high blood sugar levels. This issue will eventually show itself with symptoms such as excessive thirst and hunger and frequent urination. If you do not seek treatment for diabetes, its complications will gradually plague you. Diabetes can damage almost all organs of the body, including cardiovascular, eyes, kidneys, nerves, digestive system, gums and teeth, skin. What are the complications of diabetes? 1. Cardiovascular. Cardiovascular diseases are the cause of 2/3 of deaths caused by diabetes. Patients with diabetes are twice as likely as other people to suffer from heart diseases or strokes. However, the good news is that you can reduce the risk of cardiovascular disease and its complications by following a diet, exercising, and following up on blood sugar treatment and control. Among cardiovascular diseases, the following can be mentioned: atherosclerosis, narrowing of arteries caused by fatty deposits; heart failure, inability of the heart muscles to pump blood properly and as a result, insufficient blood supply to the body organs; arrhythmia, irregular heartbeat that can lead to cardiac arrest in some cases; stroke, blockage of one of the arteries supplying blood to the brain; high blood pressure. Symptoms of cardiovascular diseases: shortness of breath, tiredness, edema or fluid accumulation in the legs, weakness of organs, pain in the chest, back, neck, shoulders, lower jaw, or legs. How to prevent cardiovascular complications. Regardless of blood sugar control and treatment follow-up, which is the basic principle in preventing diabetes complications, the best way to prevent cardiovascular complications is to modify lifestyle. Exercise. You need to do at least 150 minutes of moderate aerobic exercise such as walking or cycling during a week. Have an ideal weight. If you are overweight or obese, you need to lose weight to reach your ideal weight. Eat good food. Try to use low-fat and low-calorie foods and add vegetables and fruits to your meals. Take your medicines regularly. Take the medicines prescribed by your doctor, as prescribed and regularly. Control your anxiety. Stress can raise blood pressure and make it difficult to control diabetes. For this reason, it is necessary to consider your mental health in addition to your physical health if you have diabetes. Measure your blood pressure regularly. 2. Neuropathy or nerve damage. Nerve damage caused by diabetes is called diabetic neuropathy. Half of diabetics suffer from neuropathy. This issue mostly affects people who have been diagnosed with diabetes for many years. There are several types of neuropathy, including peripheral neuropathy. This condition manifests itself with weakness, tingling, pain or numbness in the hands and feet. Autonomic neuropathy. This condition involves the nerves of the internal organs of the body and can cause heart, digestive, etc. abnormalities. If the numbness becomes severe, you may notice that the injury of the involved organ has spread or an infection has spread. How to prevent neurological complications of diabetes. If any of the possible symptoms related to neurological complications, tingling, numbness, pain, occur, inform your doctor. Take care of your feet. Check them every day. Use a small mirror to look at the bottom of your feet. Feel them for any damage or deformation. Use special shoes and socks and wear them all the time. Use lotion, but don't put it on your toes. Use warm water to wash your feet and dry them carefully after washing. Some sports are not suitable for people with diabetes. Consult your doctor about this. 3. Skin complications. Diabetes can affect any organ of the body, including the skin. Skin problems may even be the first manifestation of diabetes. But the good news is that many skin complications can be prevented and treated. Some skin complications are problems that other people may suffer from, but the probability of their occurrence is much higher in diabetic people, like bacterial infections, fungal infections, itching. Some other complications involve only diabetics, like diabetic blisters. How to prevent diabetes skin complications. Control your blood sugar. High blood sugar causes dry skin and provides conditions for the growth of microbes. Keep your skin clean. Do not use a very hot shower or bath. Use lotion, but don't put it on your toes. Do not let your skin dry out. Keeping it moist prevents many infections. But too much humidity is not good. In case of a large cut, infection or burn, see a doctor immediately. If you cannot manage skin complications on your own, consult a dermatologist. 4. Eye complications. You may have heard that people with diabetes may suffer from eye complications and eventually blindness. Patients with type 1 and 2 diabetes are more prone to blindness than others. However, most affected people do not reach this stage and have only mild eye problems. Among the eye complications of diabetes, the following can be mentioned. Glaucoma or increased eye pressure. Cataract means clouding of the lens of the eye. Diabetic retinopathy. This is a general term used for eye damage following diabetes. Retinopathy is associated with the damage of blood vessels to the eye, which can eventually lead to blindness. Symptoms of vision problems. Decreased or blurred vision. Sudden blindness. How to prevent eye complications of diabetes. Regular annual eye examinations can largely prevent the occurrence of eye complications. In many cases, eye complications do not have initial symptoms, but annual examinations can detect their progress earlier. It is better to consult with your doctor about the necessary intervals between eye examinations. Control your blood sugar and blood pressure regularly. 5. Kidney complications. The kidneys are responsible for removing waste materials from the blood. These two vital organs are rich in blood vessels that are responsible for blood purification. In case of diabetes and damage to these small vessels, kidney complications occur. These complications can be severe enough to require dialysis or a kidney transplant. Not all people with diabetes develop kidney complications. The possibility of these complications depends on genetic background, blood sugar control and blood pressure. Therefore, the more you control diabetes, the less likely you will suffer from these complications. Symptoms of kidney complications. Most kidney complications do not show symptoms until they reach severe stages. However, any of the following can be a sign of kidney problems. Swelling of the legs. Disruption of sleep patterns. Loss of appetite. Stomach discomfort. Weakness and decrease in concentration. How to prevent kidney complications. Control your blood sugar and blood pressure closely. If your doctor prescribes blood pressure medication, take it regularly. 5. Diabetic ketoacidosis, DKA. Diabetic ketoacidosis is an acute condition that can eventually lead to diabetic coma and even death. When the body cannot get enough glucose for energy, it uses fats. As a result of consuming fats, ketones are produced. These ketones can poison the body and put it into a critical phase. Diabetic ketoacidosis is a sign that diabetes is not under control. DKA can occur in anyone with diabetes, but it is rare in type 2 diabetes. DKA requires hospitalization for treatment and is an emergency condition. Symptoms of diabetic ketoacidosis. Early symptoms include excessive thirst or dry mouth, frequent urination, high blood sugar, high levels of ketones in the urine. Then the following symptoms appear. Feeling constantly tired. Flushing or dry skin. Shortness of breath. Nausea, vomiting and abdominal pain. The smell of fruit while breathing. Lack of concentration or confusion. Note that diabetic ketoacidosis is an emergency and dangerous condition. If you have any of the above-mentioned symptoms, call your doctor immediately or go to the emergency room. How to measure urine ketones. Urine ketones can be measured simply by using a test strip similar to a blood sugar test. Talk to your doctor about when to measure urine ketones. It is often recommended to measure urine ketones if blood sugar goes above 240. If you are sick, cold, flu, etc., it is better to measure urine ketone every 4 to 6 hours. Other complications of diabetes. Oral problems. Depression. Slow wound healing and leg ulcers. A final note about the complications of diabetes. Diabetes is a chronic disease and requires constant treatment. Diabetes can affect different parts of the body in different ways. Treatment of diabetes delays its complications. Not all people suffer from these complications. The key to preventing complications is in proper treatment and blood sugar control. Changing the lifestyle, visiting the doctor regularly and taking special care such as protecting the skin and regular examination of the feet can greatly delay the onset of complications. If you like this video, support us by liking and subscribing, and be sure to watch the recommended videos on this page.